On this Saturday night, being vaccinated against COVID-19. How Canadians feel about taking it and why the message needs to be clear.
This process should be starting and should be continued throughout the course of the pandemic.
As case numbers climb across the country, COVID-19 takes the life of a child in Manitoba. COVID-19 long haulers.
I can't really physically or mentally exert myself without having a relapse of symptoms.
The symptoms that just won't go away. Plus, Sweden switching up its strategy as a second wave hits hard. And beyond big box stores, why holiday shoppers need to remember those small businesses.
Global National with Robin Gill. Reporting tonight, Sonia Diol.
Good evening and thanks for joining us. We start with a tragic reminder that COVID-19 can affect anybody at any age. Health officials in Manitoba say a boy from Winnipeg under the age of 10 has died from the illness. It is unclear if he had any underlying health conditions, but he is the youngest victim in that province. Manitoba has the highest number of active cases, with many more new infections being reported today. 487 new cases confirmed today, its third highest single-day tally. In other provinces, Quebec shattered its highest single-day record with more than 1,400 people testing positive over the last 24 hours. There were another 1,800 new cases in Ontario for the second day in a row. And in Alberta, a staggering new one-day record with over 1,700 new infections being reported. The rapid rise in those case numbers spelling the urgency for a vaccine. But as Mike Le Couteur explains, the number of Canadians who want vaccinations to be made mandatory is dropping, even as those case numbers go up.
As preparations for a mass vaccination program ramp up, there is concern not every Canadian will line up for the COVID-19 vaccine. A new Ipsos poll for Global News shows 59% of respondents believe vaccines should be mandatory, but that's down 13 points from May of this year.
We find that number tends to break down a bit when you start going through some of those concerns. So the true number of the percentage of the population that would probably get a vaccine right away is closer to maybe about 20%.
71% of respondents are nervous the vaccine might have been rushed through approval, and nearly the same amount worry about possible side effects. Still, more than half of Canadians say they'd take the vaccine as soon as they could, reassuring to health professionals who acknowledged this isn't risk-free. However,
I personally have greater fear of the effects of a wild virus than I do of the effects of a controlled vaccine.
This week, the Liberal government announced Major General Denis Fortin will be in charge of the effort to get vaccines to Canadians. In an interview on the West Block with Mercedes Stephenson, Fortin said work has already begun.
This is so important that a specific tailor-made operation center is being put in place. It includes military officers and NCOs, but also a number of public health agency employees.
Now, one of the keys of an effective rollout is a communication campaign, making sure people understand the importance of getting vaccinated. And it takes time to build trust in communities.
It's something that's done at a local level, not at a 30,000-foot level. So this process should be starting and should be continued throughout the course of the pandemic in Canada.
A Health Canada approval for a vaccine could come in the next few weeks, or even sooner. The Financial Times is reporting the UK will approve the Pfizer and BioNTech vaccine next week, meaning Brits could be rolling up their sleeves as early as December 7th. Sonia?
Mike Le Couteur in Ottawa tonight. Thank you. Well, this week, Prime Minister Justin Trudeau said when a vaccine is ready, Canada will be ready. But not everybody is convinced that Canadians will have access as quickly as other countries, premiers in particular. This week on the West Block, Saskatchewan Premier Scott Moe shares his concern Canada is getting pushed further back in the waiting line. Mercedes Stephenson joins us now with more on that and a look ahead to this week's edition of the West Block. Mercedes?
Sonia, the Prime Minister and his team keep pointing to the hundreds of millions of vaccine doses that Canada has signed agreements for. The Trudeau government has deals with 7 different vaccine developers, and Health Canada says it could approve a first vaccine as soon as next month. But the leading vaccines will all be manufactured outside of Canada. So the big question is when they will be delivered to this country. I spoke with Saskatchewan Premier Scott Moe. He says the federal government isn't doing enough to get its hands on those vaccines and should do more as soon as possible.
What's troubling about this is we are seeing not just the producing countries like the UK and the US that are going to be out with full-scale vaccinations sometime here in December, but many other countries that seem to be gaining a quicker access to these vaccines than we have here in Canada. So we need a more ambitious procurement program for sure.
All throughout this week, we heard concerns that Canada is slipping further back in the line to receive its share of that desperately wanted vaccine. The country's top health officials have said that Canada's initial supply will be limited, but that every Canadian will have the opportunity to be vaccinated. Dominic LeBlanc, the federal minister of intergovernmental affairs, insisted on the West Bloc that Canada will be among the first 5 countries to get the Pfizer vaccine.
Our government decided at the very beginning to ensure that we were aggressive and robust in procuring binding agreements so that when these vaccines are safe for use in Canada, as determined by independent scientific expertise, we would be ready to vaccinate Canadians efficiently and effectively.
So more than 9 months into this pandemic, we're seeing some light perhaps at the end of the tunnel, but still lots of questions about just when most Canadians will receive that vaccination and Canada's readiness. We'll dig into all of that and more on the show. Sonia, back to you.
Mercedes Stephenson in Ottawa, thank you. And you can watch the West Bloc with Mercedes Stephenson tomorrow, right here on Global. The US is expecting to have its first doses of the COVID-19 vaccine in a matter of weeks. Health officials will be holding an emergency meeting next week to decide who is going to get it first. More than 13 million Americans have now tested positive for the virus, and over 265,000 people have died. But as Jennifer Johnson reports, there's a growing fear that the worst is still yet to come.
As the COVID-19 pandemic continues to spiral out of control in the U.S., an advisory panel with the Centers for Disease Control and Prevention has called an emergency meeting Tuesday. It will vote on who will get the vaccine first when it's approved. Cedars-Sinai Hospital in Los Angeles has ultra-cold freezers ready for hundreds of thousands of doses.
The vaccines are becoming available right at the time that we're experiencing another surge. So the nurses who commonly would be the ones to administer the vaccine are needed at the bedside to care for COVID patients.
By next week, it's estimated a quarter of all U.S. hospitals will have staffing shortages. In some areas, workers with the virus but no symptoms are being told to return.
It is a mixed message to the public to allow asymptomatic COVID-positive nurses, physicians, and other healthcare workers to work.
There you go. With the virus rapidly spreading, local officials are being forced to take desperate steps to slow the spread. A 3-week stay-at-home order in Los Angeles County, the nation's largest, starts Monday, prohibiting all public and private gatherings. Deaths in the county have recently tripled.
Just 2 weeks ago, we were looking at maybe 1,200 cases a day, and now we're at 4,700 cases a day.
Doctors are begging people to stay home and stop socializing, a warning ignored by millions over the Thanksgiving holiday.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
Every day, well over 1,000 Americans die of COVID-19. Those who survive know how lucky they are.
It's really frightening. I thought an asthma attack was frightening.
It's expected healthcare workers and those living in long-term nursing home facilities will be the first to receive the vaccine. The Food and Drug Administration will meet with its advisors about the vaccine rollout plan December 10th. Jennifer Johnson, Global News, Washington.
Well, as COVID-19 cases grow around the world, so too does the condition known as long COVID. That is when symptoms continue for weeks, even months, after a person is no longer considered contagious. A UK study done early in the pandemic found 2 to 3% of patients were still suffering from challenging symptoms. But America's top infectious disease expert believes 25 to 35% of those infected will become long haulers. A new clinic is now open in Canada studying how how, when and if long haulers will get better. Robin Gill reports.
Katie McLean can't go anywhere, can't see anyone because of what COVID-19 has done to her health.
I can't really physically or mentally exert myself without having a relapse of symptoms.
McLean tested positive for the virus in September. She had all the symptoms: cough, shortness of breath, a racing heart, and debilitating exhaustion. 9 weeks after her diagnosis, she's still suffering from those same symptoms.
It makes me worry about, what about the rest of my life and what's that going to look like?
McLean is part of a group called COVID long haulers, a term used to describe those who have symptoms well after the virus has left their system. At St. Paul's Hospital, Canada's first post-COVID clinic, a team of specialists is trying to understand the conundrum of the long-term effects of COVID.
It's a little bit too early in the game for me to give you statistics and an age range for who is suffering these symptoms. I can tell you that I'm seeing a lot of people under the age of 50 that are having sort of ongoing symptoms. I'm seeing people over the age of 50 as well.
Doctors are learning from patients as they go along.
We don't have enough time to really say how long these symptoms are going to happen for, because this is a novel disease and we are following them along their journey of their illness.
The answers may be found in the 160 patients they're treating because they're also the backbone of crucial research at the clinic.
Have you taken anything for the fever?
Jacqueline Robinson is part of the study as a nurse and a patient. The 42-year-old contracted the virus during the first wave in March.
Now I've had COVID and ended up on a ventilator, hugely passionate about COVID research and helping this patient population. And I want to give back. That's my heart. I want to help other patients and families who are going through this.
As for Katie McLean, she has many more rounds of tests in her future.
Do you feel like a guinea pig? I do a bit because we just don't know how this is going to play out yet.
For now, she's taking it day by day, even though each step she takes still takes her breath away. Robin Gill, Global News, Vancouver.
And Robin delves deeper into the problems plaguing long haulers tonight at 7 on The New Reality. You can watch that right here on Global. The Ontario police officer fatally shot in the line of duty on Manitoba Island earlier this month was laid to rest today. An investigation into Constable Mark Hoving's death is still ongoing. Another civilian also died in hospital after the shooting in Gore Bay on the 19th of November. During today's funeral service, OPP Commissioner Thomas Karakay said Constable Mark Hoving was nothing short of heroic and he approached every day with bravery. His wife Leanne thanked the community for the outpouring of support and the ocean of love for the family. Still ahead, the anger in India as farmers clash with police to make it to New Delhi. We'll tell you why in just a couple of minutes. Welcome back. Well, Ethiopia's government claims to be in control of the capital of the Tigray region after more than 3 weeks of intense fighting. Military forces entered the city of Mekelle today in a final offensive against the Tigray People's Liberation Front. Communications in the region have been cut, making details of the assault difficult to confirm. But on Twitter today, Ethiopian Prime Minister Abiy Ahmed claimed the military has ceased operations in the Tigray region and the focus is now on rebuilding and providing humanitarian assistance. Since the conflict started earlier this month, more than 40,000 refugees fled the region, seeking shelter in Sudan. Thousands of angry Indian farmers protesting agricultural reforms have been allowed into New Delhi after violent clashes with police who fired tear gas at them to try and keep them out. The farmers are being escorted to a protest site in the city. They started the march on Thursday to pressure Prime Minister Narendra Modi to scrap the laws that they fear will cut back their earnings and give more power to corporations. Tensions are running high between Iran and Israel tonight. Iran's supreme leader, Ayatollah Ali Khamenei, is vowing revenge after the killing of the country's chief nuclear scientist. He says the work will continue. For Footage of the funeral for Mohsen Fakhrizadeh aired today on Iranian state television. According to their reporting, Fakhrizadeh was ambushed and killed by gunmen on the outskirts of Tehran on Friday. Western intelligence agencies believe Fakhrizadeh was behind a covert Iranian nuclear weapons program. Nobody's claimed responsibility for the attack, but Iran is blaming Israel. Still ahead, Sweden ramping up its relaxed pandemic strategy as a second wave is hitting the country hard. Sweden has so far resisted a national lockdown, but it's rethinking its strategy after recording a surge of second wave infections. Tonight, its citizens are being told to stay home. Strict measures also going into effect. As Crystal Gaman-Singh reports, Sweden has been slammed for taking a lax attitude towards COVID-19, but is now being hit with more deaths than its neighbours.
There are few masked faces in Stockholm, but these outdoor spaces are covered with those familiar warnings to keep your distance. A second wave of COVID-19 is hitting Sweden.
It's big debates on the TV all the time, how we should manage this and so on. So I don't think we are easygoing. we are affected by this disease as every other country.
Dr. Johan Lunegard is the chief medical officer at Sweden's oldest university hospital. He doesn't subscribe to the theory of countries being COVID-19 winners or losers. Strategies work until they don't, and right now he says his staff is exhausted and in a tough situation.
Up to 1/5 of all the patients in the hospital are COVID patients. And almost half of the intensive care unit patients are COVID patients at the moment.
Transmission rates in Sweden are substantially higher than in neighboring Norway, Denmark, and Finland, with more than 240,000 confirmed cases. The loss of life in other Scandinavian countries where lockdowns have been in place off and on for months is substantially less. In Sweden, there's been roughly 65 deaths per 100,000 people, while in Denmark, that number is roughly 14. In Finland, it drops to 7 per 100,000, and in Norway, it's 6. Swedish officials admit there appears to be little evidence of herd immunity, and infections continue to rise. In an effort to curb social gatherings nationally, alcohol cannot be sold after 10 p.m. in restaurants, bars, or nightclubs, and formal public gatherings have been reduced from 50 people to 8.
What we do know from local reports is that it has changed behavior of people. We can see that more people are starting to work from home.
Sweden's Prime Minister Stefan Löfven made a rare national address last weekend telling people to cancel their plans and stay home. But that is just a suggestion.
It seems like the Swedish population take it more seriously.
As infections and hospitalizations rise, the Swedish Statistical Agency says that for the first time in a century, life expectancy in the country will drop because of COVID-19. As for the current rate of transmission, it's hoped the new measures will start to drive down infections. Crystal Gaman-Singh, Global News, London.
The Vatican is marking a historic moment. Wilton Gregory, the Archbishop of Washington, D.C., has become the first black cardinal from the U.S. The 72-year-old was one of 13 new cardinals blessed by Pope Francis on Saturday. In June, Gregory blasted President Trump's visit to a historic Washington church when soldiers had to use tear gas and rubber bullets, they say, to clear anti-racism protesters along the way. Shop so they don't drop. Coming up, how local businesses are banking on your loyalty. Well, despite pleas from health officials across the country, thousands of Canadians spent Black Friday in a shopping centre. This is what it looked like yesterday in Calgary's largest mall. Many shoppers were wearing masks, but there was almost no physical distancing. Police had to be called in to disperse the crowd. In Ontario, at least 6 businesses in the York region were fined for not following public health rules. Well, this weekend is typically one of the busiest shopping times of the year, but many stores have been forced to close or stop in-person sales because of the pandemic. This time of year also crucial for the survival of small businesses. And as Catherine Ward explains, there's concern that online sales alone may not be enough to save them.
There is just something to be said for the human connection.
Kara Kennedy has run her high-end consignment shop in Toronto for the last 4.5 years. People have always been able to shop online from anywhere in the world, but she says it's the in-store purchases that have been key for the bottom line.
There's a lot of stuff in our store that's pretty high quality, and you really have to touch and feel it to want to buy it in person. So it's really hard to replicate that experience online.
Last year, 75% of Kennedy's sales came from in-store purchases. With more lockdowns rolling out, small businesses across the country continue to struggle as governments try to balance restrictions and safety in light of COVID-19. Recent data from the Canadian Federation of Independent Business suggests only 38% of retail shops are hitting normal sales compared to this time last year, and 1 in 7 are at risk of shutting down permanently. On Monday, the Canadian government is expected to deliver its fall economic statement. Experts say they hope more will be offered for small and medium-sized stores.
There are still tens of thousands of businesses slipping through the cracks of the wage subsidy, the rent subsidy, and the CEBA loan program. We're hoping that the government will announce fixes to them, especially for new businesses started in 2020. They don't qualify for any of the programs.
Digital experts say investing in paid advertising can help leverage a small business online, but they say the best thing owners can do is to tap into their current customer base.
What are you doing for your loyal customers? Are you giving them incentives to sort of share? What are you doing with the email list that you already have? Are you, emailing out customers, telling them about promotions, telling what you have?
Kennedy says so far she has seen an increase in online sales and remains thankful for the customers who are choosing local options.
They know that small business is important and people are actively seeking to buy from small business. And I think that is going to save us.
Catherine Ward, Global News, Toronto.
And that is Global National for this Saturday. I'm Sonia Diol. Tonight's Your Canada is the snowy fields outside of Airdrie in Alberta. Do send your photos to viewers at globalnational.com. Thanks very much for watching. I'll see you back here tomorrow. Good night.